I'm Lisa Federico with Affordable Medicare Solutions. We provide free and unbiased information about Medicare and plans that work alongside Medicare. I'm here today to talk about enrolling into Medicare if either you're 65 and just turning Medicare age and eligible, or if you have lost employer coverage for whatever reason. I know right now is sort of a different time. It's difficult and challenging with the pandemic, and people who chose to work past age 65 are finding themselves out of jobs and needing to access their Medicare. So that's what I'm here today to do, to explain how to navigate the Medicare system. Let me real quick share my screen with you. I have some slides about Medicare and how to navigate the system. So today what we're going to talk about is if you're aging into Medicare, you're turning 65 and therefore you're eligible, welcome to Medicare, how you go about getting your Medicare coverage. Or if you are losing your employer coverage and need to start your Medicare, how you go about that, how to actually get your A and B Medicare put in place, how we can help with that, and then next steps. So for people who are aging into Medicare, that means you're turning 65. Anyone who is 65 and has paid into the Medicare system for 30 quarters is eligible for Medicare, and that starts in 3 months prior to your 65th birthday and ends the 3 months after your 65th birthday. That's known as your initial enrollment period. That's when you're first entitled to Medicare. And when people first enroll in Medicare, you have two paths in which to take in order to get your Medicare coverage and get the best coverage for you. The first path is traditional Medicare with purchasing a Medigap plan. A Medigap plan is a supplemental policy that fills in the gaps and helps pay for the out-of-pocket costs after Medicare makes their payments. With Medigap plans, there are no pre-existing condition clauses. Anyone can purchase a Medigap policy in the initial 6-month window from the time you turn 65 and get into your A and B Medicare. Most Medigap policies have low or no deductibles. If you have a Medigap policy with traditional Medicare, you would pair it with a prescription drug plan offered as a Part D plan through Medicare as well. And you can move plans anytime throughout the year. The other way of having Medicare coverage is to go with a Medicare Advantage plan instead. You're still enrolled into traditional Medicare, but you choose to enroll into a Medicare Advantage plan, which is a health plan that is offered by one of the insurance companies. All the big insurance companies have contracted with Medicare to offer these insurance policies that look more like what you're familiar with or used to as a working person. They're managed care plans, HMOs and PPOs, private fee-for-service plans or special needs plans, but they're all managed care types of policies. In addition to the regular coverage for doctor's visits and hospital services and things like that, the managed care plans, the Advantage plans, can offer additional benefits for things that are not normally covered under traditional Medicare. Services like dental and vision and hearing coverage, along with maybe some transportation to and from medical appointments, or an allowance to spend on over-the-counter items. These are services that are traditionally not covered under regular Medicare. You can join, anyone can join a Medicare Advantage plan with any pre-existing condition whatsoever, with the exception of end-stage renal disease. But you can only enroll into a plan or change plans during the annual enrollment period, which is October 15th through December 7th, or the open enrollment period that are just for Medicare Advantage plans, and that runs from January 1st through March 31st. Now, if you are losing employer coverage, you have two options. If you're under age 65 and you're losing coverage, then you'd want to either look at continuing your employer coverage through COBRA or purchasing a policy through the Health Place Marketplace and Affordable Care Act plan. If you're over age 65, that's when you want to get your Medicare going. You want to activate your Medicare. And the way you do that is by using what's called a special election period. And that special election period is the fact that you're losing your employer coverage. Now, when you're losing your employer coverage, in order to activate your full Medicare, you need to do that through the Social Security Administration. Enrollment into Medicare goes through Social Security. So you go to the URL of ssa.gov and create a personal login. Now, first, you'd want to unlock your credit if you have put a freeze or any type of a lock on your credit. Go ahead and unfreeze that for a short period of time so that you can go in and create your personal login and request to enroll into Medicare. Once you've done that, and if you're getting your Medicare because you are losing your employer coverage, you want to be sure to have your employer, your HR department or supervisor complete an employer verification form. And that form can be found on the Social Security site, or we can provide that for you. You can reach out to us. We have the forms and we would be happy to provide that for you. Now, usually you would take that form with you in person to the Social Security Administration in order to enroll into Medicare and provide them with the information on the form about your current employer. But right now, all these Social Security offices are currently closed due to the pandemic. So you need to mail in the form or perhaps fax it in to a Social Security office. There may be drop-off locations at the Social Security offices, but I'm not really sure if they're still doing that, so you would want to mail it in. You can reach out to us and we can help with that if necessary. We're happy to help. This is a screenshot, a quick look at the Medicare site. And this is right here where you click to sign up or click on Medicare enrollment. And this is where you would create your Social Security login information. And this is a quick shot at the employer verification form. Down at the bottom, if you notice here, I've circled the two really important pieces of information that need to be provided. And that's the signature of your either HR person or supervisor or whomever is in charge of completing this type of a form. Without that signature and the person's title, the form isn't valid, so you need to provide that information. Now, if you are turning 65 and therefore eligible for Medicare, it's a different process. You at age 65 would have your initial enrollment period, and again, that starts 3 months before your 65th birthday and ends 3 months after your birthday month. If you're already receiving Social Security benefits or railroad retirement benefits, if you're already getting a check, then you will automatically be enrolled into Medicare, both A and B. Now, if you're still working, you would want to go ahead and decline Part B until you've stopped working. You can keep Part A, there's no premium for it, but you would want to hold off on taking Part B until you've stopped working and you meet your Medicare Part B coverage. If you're not receiving your Social Security check yet when you turn 65 and you're not working and you need your Medicare to start, that's when you need to sign up through the Social Security Administration as well. You would follow the same steps. You'd go to Social Security, the website, and enroll into Medicare. The only difference being that you would not need to provide an employer verification form because you're not working, and that you don't need to show that you've been continuously working and covered through your employer. Now, you can enroll, sign up for Parts A and B anytime that you're still covered by the group plan. So if you know that you're going to be losing your coverage, that's when you want to go ahead and reach out to Social Security and initiate that enrollment process. And you have up to 8 months from the time that your employment ends or your coverage ends, whichever is sooner. So you have an 8-month window in order to enroll into Medicare. If you are enrolling into Medicare because you're losing your employer coverage, then you would need to have that employer verification form completed. This is the Medicare website. So once you have gotten your Medicare in place, you want to go ahead and create a Medicare.gov account. So this tab here, log in or create an account, is where you can start, or down at the bottom where it says no account, create one now. You want to create an account using your Medicare information, your Medicare number, Part A and Part B effective dates, along with your date of birth and some other information. And by creating an account, it allows you the opportunity to better manage your Medicare benefits and know what you have, what other policies you have in place, and keep up with claims that have been paid by Medicare on your behalf. Now, if you've gone ahead and you've initiated enrollment into Medicare through Social Security, that's when we can help with starting to look at all of your options. And once again, what we do is free. There's no cost to you. We can help to explain the different paths of Medicare, what your personal options are, what you're based on your medication and physician's needs, where you're located, what would best work for you. Our discussions are entirely personalized based on your individual needs. So we will help you navigate the system and help you make decisions. We can help you create a Medicare login if you need that help. I encourage you to go ahead and get that login done, but we're absolutely happy to help you with that. Make sure that your physicians, the doctors that you're seeing, take Medicare, because if they don't, then you may need to consider changing physicians to doctors who do accept Medicare. If you're going to enroll into a Medicare Advantage plan that has dental benefits, then you want to check with your dentist to find out what plans they enroll into. This information helps us make sure that we're looking at options that best work for you based on your needs and the doctors that you see and dentists that you see. What we also do is every year schedule a free annual review during the annual enrollment period, October 15th through December 7th. And that's the time that we take a look at your current plan that you're in right now and compare it to the plans that are coming up next year to make sure that your plan is still the best one for you. The plans do tend to change from year to year, and we just want to make sure that what you're in now is what will work best for you in the future. We definitely are not set it and forget it. We're not a set it and forget it type of agency. A lot of agents do that. Unfortunately, they will just enroll you into something and then you never hear from them again. With us, it's an ongoing relationship. We want to be sure that your needs are being met by your Medicare coverage. And if they're not, if something has changed, then we're out here to help you make sure that your coverage is the very best for you and we can make any changes that need to be made. Once you've received your Medicare card, that's when we can help do the enrollments into the plans that you've chosen. So through our discussions, we can help you navigate the system, make the choices for policies that best work for you, and we can do those enrollments for you. Once we've applied for policies on your behalf with your input, then we will track the enrollments with the insurance companies until the policies have been approved, at which time we'll reach out and let you know that. From that point on, you have about a 2-week time period to wait for the insurance company to send you your welcome package. But if anytime during that time you need your ID card, we're happy to help get you a temporary ID card that you can use until you receive your permanent card. So it's a pretty straightforward, easy process, and we're here to hold your hand throughout the entire process from beginning to end. If you have any questions about Medicare information in general, you should visit our website at affordablemedicaresolutions.com, and on it we have lots of materials that we put together to help explain Medicare in easy to understand pieces. Medicare can be fairly confusing, and it's easy to have it kind of broken down into little bite-sized pieces, and that's what we've done. And we hope that you can find what you're looking for on our website to help answer your general questions. And if you need more information, then please feel free to reach out and give us a call. So thank you so much for sharing with me your time today, and hopefully I've been able to give you some helpful information. I look forward to speaking with you soon. If you have any questions, just feel free to reach out. Our number is 770-945-5261. My extension is 611. Thank you again, and I look forward to speaking with you soon.